There's a moment in medicine when our body can make a brutal executive decision for itself. Yes, we are limb salvage experts and amputation prevention, but what happens when the body amputates itself, aka auto amputation? So sometimes there is the body actually making its own decision to amputate that part of its body itself. So there's no blood, there's no oxygen, there's no means of survival. And instead of the body trying to heal it, the body actually abandons it and says, you know what, I'm going to cut you off myself because they're not going to cut you off. So we're going to talk about auto amputation, like, and when tissue dies. And we're also going to talk about the term demarcation. Okay. And this is why, it happens to some people and it could actually cost you your limb or your life if it gets infected, but it's literally your body trying to also protect itself. Okay. But the body can auto amputate. There is something called auto amputation, and that's not done by the physician, it's called by your own body. Okay. So, what is auto amputation? Oh, by the way, this is Diabetic Foot Files with Dr. G. Hmm. Okay, so what is auto amputation? Because you're supposed to know all this stuff. So, auto amputation is a passive biological consequence of one sustained critical ischemia. So, you know, the blood flow is not there. Irreversible cellular necrosis, so the cells are dead fully. Immune isolation of non-viable tissue, so the body's trying to wall off all this dead tissue and say, "Do not touch the healthy part of me," and doesn't want it to spread, and it mechanically separates over time. So it's not really a program, and it's not controlled and not really protective. It's pretty much the body saying that this tissue is metabolically unstable. I will wall it off and survive without it. Okay, sound like some people. Okay, so what is the mechanism of auto amputation step by step from blood flow to bone loss, right? Because your body can literally auto amputate its own bone. It's amazing that your body is smart enough to wall off things that are very hurtful. That's what abscesses are, right? Their body is trying to wall off. Like, even when you have a foreign body, the body's trying to wall off. But the body can also auto amputate. And I know people think that is so weird, but it's so cool that your body has that mechanism to do that. So, auto amputation cannot occur without severe vascular compromise. Okay. See why I love me some vascular? So, macrovascular failure, such as peripheral arterial disease, atherosclerotic plaque, thromboembolisms, or calcified non-compliant arteries that happen in patients with diabetes. Now, we also have microvascular failure. So things like the capillary basement membrane thickening, endothelial dysfunction, impaired nitric oxide signaling, and red blood cell rigidity. So the critical threshold when it comes to that is when the tissue perfusion falls below 20 to 30 mmHgs milligram, like mmHg's oxygen tension, and the cells cannot sustain aerobic metabolism. Aerobic, aerobic. That means it needs oxygen. Okay. Step two, there's going to be a metabolic collapse at the cellular level. So without oxygen, because our bodies need oxygen, aerobic respiration stops and the cells actually switch to anaerobic glycolysis. And the ATP, I think everybody in science knows what ATP is, okay? Adenyl triphosphate, adenosine triphosphate. And that's like, just equate that with energy, okay? The ATP production plummets, okay? And then lactic acid accumulates, okay? And that causes intracellular acidosis. So, what does ATP depletion cause? Because of the anaerobic glycolysis that is going on in the body, because there is no oxygen, their aerobic respiration has completely ended. The ATP production plummets, and that production or depletion of ATP causes a failure of the sodium potassium ATPase, the sodium water influx, the cellular swelling, and the organelle rupture. And this is irreversible necrosis. This is not apoptosis. This is irreversible necrosis. So, necrosis. Necrosis is unregulated, it's a pro-inflammatory response, and it's membrane destructive. So, what dies first when it comes to necrosis? The skin, the subcutaneous fat, the muscle, the nerves, and then the bone, osteocyte death. This is why the pain may initially worsen, like with ischemia, and then disappear completely because of the nerve death. So, pain relief when it comes to your body, a part of the body dying, like having necrotic tissue, that's not the best sign because that most means that they already got to the nerves and the nerves are dead. Pa- So keep that in mind. Then your body has to recognize, hey, there's a dead part of me here, okay? And I'm still alive and I don't want this dead part of me here. So your body immune system recognizes that there's this necrotic part of your body and your body is going to try to biologically isolate that dead tissue. So the dead tissue, when tissue is dead in your skin, dead tissue releases something called DAMPs, damage associated molecular patterns. And also, it releases intracellular proteins and there's necrotic debris. The immune response of your body responds by recruiting macrophages. We love macrophages because they eat, right? And activating fibroblasts and also producing cytokines like TNF alpha, IL-1, IL-6, right? And here's the key. The immune system cannot clear dead tissue without blood flow. So it builds a border. So that's where we come to this word demarcation. Okay, demarcation is like the border. So, what is demarcation actually? Demarcation is fibro-inflammatory interface between viable tissue and non-viable avascular necrotic tissue. So, demarcation is the border that the body makes between the dead tissue and the viable tissue, okay? It's created by fibroblast proliferation, collagen deposition, macrophage signaling, and capillary termination. And the demarcation, the border is where the blood flow ends. You're going to see the body's going to literally what we call demarcate itself. It's going to show you like I mean, you can get imaging, but it's amazing. Your body talks to you. It literally will show you, hey, this part of the body is dead and this part of the body is still alive. So you save that part that's live and pink, but I'm walling off this dead part of of this person's body. Okay? And there's no reverse. There's no turning back. You can't heal it because it's completely dead. So why does demarcation form like where it does? It's because it's a line that forms the last capillary bed capable of sustaining metabolism. So factors that determine the location of demarcation is collateral circulation, arterial pressure gradients, microvascular integrity, and tissue metabolic demand. And this is why demarcation can move proximally. Proximally, okay, so distally means towards towards the end of the body, the toes. Proximally means towards the top of the body. So when we say, oh, the infection is progressing proximally, that means it's going towards the upper part of your body. If it's if it's progressing distally, it's progressing towards the distal part of the body, like the below the part of the body, okay? And and it can disappear with infection as well. So what remember that demarcation is the border, but demarcation is not epithelialization. Please do not say that. That will make me upset. Demarcation is not granular tissue. Demarcation is not any stability, and demarcation is not permission to wait. Demarcation is your body literally a biological ceasefire, not recovery. So how does auto-amputation physically occur? Once the demarcation is established, okay? So your body walled off that part of the body, okay? Because auto-amputation can't happen without the demarcation. The body has to wall off the non-viable tissue to the viable tissue, okay? And your body literally saying, that part is fully dead. I don't want anything to do with it. This part is alive. And I just want to keep us separate now, okay? So how does auto amputation physically occur? Desiccation. So desiccation is there's no blood, there's no moisture. We want to keep that area dry. We do not want that area wet. The tissue dries and it shrinks, and the skin becomes mummified. Like the mummy returns, it becomes black and mummified. That's what we want. We want it dry. I want it dry. If it gets wet, that is an issue because wet gangrene, that means it will spread and there's an infection. We want it dry and dead, okay? I mean, this might be the first time y'all hear me say that, but this is your body auto amputating, literally walling off a dead part of the body, okay? Tendon and ligament breakdown. So the collagen fibers denature and there is loss of tensile strength. So I wouldn't expect, let's say the body demarcates all the five toes, right? I wouldn't expect you to be able to wiggle your toe. Bone reabsorption. So the osteoclast activity persists because the body's trying to repair itself, but the osteocytes are dead. And then the bone becomes very brittle. That's why when you see the demarcation, it just looks like a mummy. Like when it's fully mummified, you should see the bone, right? Mechanical stress, things like gravity, shoe friction. I mean, to be honest, when it comes to demarcation and auto amputation, I don't expect you to be in the shoe. Okay. Eventually, the segment separates. Okay. Your body's going to separate itself. This isn't a clean process. It often leaves exposed bones, an open wound, and infection risk. Okay. So when when does demarcation end? Demarcation ends when the revascularization occurs, the area where the tissue survives and the line regresses. You do not want infection to develop because the line will dissolve and the infection will continue to spread proximally. You do not want ischemia to worsen. That means the line will progress proximally. You know, it's a trend. It will go higher up to the viable tissue. We do not want, if the amputation occurs, the tissue detaches. Okay. And demarcation is dynamic. It's not like a fixed thing. So why or how can auto amputation fail? Because I'm sure some people, especially if they've had gangrene or something like that, they have been told sometimes by a physician that, oh, we're gonna wait till it demarcates or that it's gonna auto amputate, it's gonna fall off on its own. Your body's literally gonna tell us where it's dead and it's gonna try to fall off on its own. So auto amputation fails when there is bacterial colonization along the necrotic tissue. That's why you really use the go-to is really iodine to keep it clean, dry, and prevent infection because iodine is such a strong antiseptic. But the other problem is, let's say the patient is allergic to iodine, but or some people, I've just seen some people also just use dry gauze. I never done that. I try to err on the side of caution because our bodies are filled with bacteria. There's not a place where there is no bacteria. So bacteria just wants to like literally bacteria is like a home like they're homeless. They just bacteria doesn't have real home. They always want to find a new place, right? In my opinion. Okay. So with auto amputation can fail if the bacteria colonizes the dead necrotic tissue and skin fissures can form. Especially if the bone is exposed, that's really bad. We do not want that because the bone infection will progress to the healthy bone. And then infection immune access suddenly increases. But dry gangrene, we do not want the dry gangrene to progress to wet gangrene. That's something that we do not want. Okay. We want to keep it dry and stable. Okay. Until it fully demarcates. And you have to make sure it keeps localized. If it doesn't keep localized, it becomes systemic. Then the body, it becomes part of the body and the infection will progress. And then sometimes the toe, let's say the patient has demarcation, gangrene of that toe, the toe literally just demarcates itself and it trying to auto amputate, but they didn't keep it dry and did not prevent infection. Let's say they didn't put iodine on it and they're just walking in the regular shoe with it, and then eventually it becomes infected or that part just falls off and leaves a open exposed bone and a wound, and that can cause infection. So when it comes to ischemia and peripheral arterial classifications, to determine why the demarcation occurs, there are classification systems when it comes to vascular failure. You have to know these stuff for your boards, but there's like the Rutherford classification system, which is for peripheral arterial disease severity. So when it comes to demarcation, it's going to most likely be a stage 5 or 6, where there's ischemic ulceration of gangrene. This is where demarcation occurs, or the Fontaine stage is. I think stage 4 is where there'll be ischemic necrosis or gangrene, and this makes the patient at an auto-amputation risk zone. And then when it comes to like wounds, the Society of Vascular Surgery made the Wi-Fi system, right? I believe. And that classifies wound ischemia and infection. So auto amputation occurs outside of the Wi-Fi goal, okay? It represents a failure to reverse ischemia, okay? So you have to always remember a limb progressing to auto amputation would typically score high ischemia plus wound, okay? Often will delay infection. Often with delayed infection, okay? So let me just do, I would say, unofficial staging of demarcation and auto amputation. Okay. So stage 1, ischemic injury. The area is going to look dusky, cyanotic skin. The patient's going to be in severe pain, and there will be no necrosis yet. Stage 2, established necrosis like a black eschar or dry gangrene. There will be no bleeding and sensation diminished. Stage 3, demarcation phase. So there will be a clear line between the viable tissue and the non-viable tissue. This, like we said, demarcation is I keep on saying a fibro-inflammatory border, and we want to keep it stable, because if it's stable, that means it's not infected, okay? Stage 4 means this is the separation phase. So the tissue is dried up, desiccated. The tendon and the bone possibly could be exposed, and the mechanical aspect of that part is loosening. Stage 5 is the amputation stage. So this is spontaneous detachment. You would think that we need to be on National Geographic ourselves, because we've seen animals with their little auto amputation, or they lose a part of the limb and it like cuts off on its own. Isn't that cool? But I mean, I was just education, the more you know. But auto amputation, that's stage 5. Spontaneous detachment, there's going to be a residual open wound, and this patient is at a high risk of infection. I wouldn't say this is a official classification system. Actually, not. I don't think there is one, but we're just going through the stages so that maybe they should make a classification system. So anybody out there, okay. Another thing when it comes to auto-amputation, it really has nothing to do with diabetes or anything, but I just always like to think a little bit about it. It's not gangrene or anything like that, but I associate it with auto-amputation and its diagnosis, okay? It's called Anaheim. So it's spelled Anihum. So Anaheim is dactyliasis spontanea. So what is it? It's not gangrene, nothing like that. It's a mechanism of fibrotic constriction. It's not arterial occlusion, but it's nice to know that this diagnosis, the patient is at risk of auto-amputation as well. It is a progression of mechanical strangulation. So the body literally strangulates itself. This occurs usually without diabetes, okay? And there's no staging system for Anaheim as well, but it's early. It causes progressive constriction, like literally the body strangulates itself. So, like I said, it's a fibrotic constriction, not an arterial occlusion. And there is osteolysis and auto-amputation. So Anaheim is a distinct, complete entity from it, okay? It has nothing to do with diabetes, but the patient is at risk of auto-amputation, okay? So I just want people to keep that in mind, because that does happen in boards. They will show you a toe with an Anaheim. Look it up. Anihum, Anaheim, okay? Usually you'll see it like on boards. They will show a baby toe that's like it looks like a thread, a strong thread strangulating a little toe. Okay. Okay. So let's go through some quick board questions. So high board questions. What, which metabolic failure initiates ischemic necrosis? ATP depletion from loss of oxidative phosphorylation. Okay. 2, I'm gonna make this super quick. Why does pain sometimes disappear in advanced ischemia? Because there is nerve ischemia and necrosis, so the nerves died and they can't work anymore. They can't give you the signals anymore. What does demarcation present? Demarcation is the interface between perfused viable tissue and avascular necrotic tissue. 4, which conditions allow safe observation of dry gangrene? Absence of infection, stable ischemia, and close monitoring. And I'm being honest right now, if the body is demarcating and there's any aspect of dry gangrene, you should have vascular on your team. Vascular, 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 okay? Like, we can't play all the time without daddy. Vascular is daddy, in my opinion, okay? So forgive me if that hurt anybody's feelings, but yeah, vascular is daddy. They can turn the dead to living. That's what vascular does, in my opinion, okay? They're the blood flow keepers, right? Okay, what converts dry gangrene to wet gangrene? Bacterial contamination. Which cells primarily form the demarcation zone? I re- Fibroblasts and macrophages. That is a good thing to remember because I rarely see people test on that. Why is auto-amputation not considered limb salvage? It's not considered limb salvage because it reflects irreversible vascular failure. It's not tissue recovery. Limb salvage is tissue recovery, okay? Which structure reabsorbs last during auto-amputation? The bone. What is the circumferential constriction band leading to toe loss called? Anihum. Anihum. Dactylysis spontanea. And then last one, the most dangerous clinical misconception about demarcation is that it indicates healing or safety. No, it doesn't. You have to monitor this very closely, could progress to worse, okay? So just remember, auto-amputation is not the body trying to heal itself. It's the body cutting its losses. It's like, I'm done. This part is dead. Gotta go. And demarcation, I wouldn't say it's hope. It literally is your body walling off that dead part of your body. So it's like the last line of survival drawn by biology. Like your body is an amazing machine. It's fascinating. And that your body knows what to do without you telling it. Okay? So this is Diabetic Foot Files. I hope this episode was helpful for some people. Audio amputation and demarcation so that we can understand much better and take care of your feet because they take care of you.